Good evening, professor and students. My key components research proposal is pressure. More than 2.5 million people in the U.S. develop pressure ulcers yearly. About 1.5% population is affected by wound at any time. It can become very challenging when you have pressure ulcer because it takes a team effort to be successful. It can also be frustrated and overwhelming to patients and also the caretakers. One of the most expensive problems in healthcare that is affected by Medicare reimbursement is pressure ulcers. In 2008, Medicare stopped giving reimbursement if the patient did not come in with an ulcer but left with an ulcer. The hospital had to fit the bill because Medicare would not give them a reimbursement. And it can also be represent and means is failure of care. That means patient is not getting the quality of care they're supposed to be getting. What is pressure ulcer? Injury to skin and underlying tissue from an extended amount of time over bony prominence. It is also known as bed sore and decubitus ulcer, and it comes from shear and friction. It comes from also extensive exposure leads to a decreased capillary flow, obstruction, and tissue ischemia. So if you have like a lack of blood flow to a certain part of your body, that's a bony prominence issue area, you can get ulcer. Causes of pressure ulcer: involuntary muscle movements, moisture of skin surfaces, poor nutrition, incontinence, impaimentation, and impacts injuries such as spinal. Some of my research questions are: what role do the skin barrier plays in preventing pressure ulcer? How common is pressure sores in ICU units? Which are the best strategies in alleviating frequency of pressure ulcer in ICU patients? What is more effective in ICU patients, skin barrier or repositioning? My hypothesis for my research questions is elimination of pressure ulcers comes from early identification and intervention. So the earlier you start to eliminate ways that you could get pressure ulcer, like repositioning, it would decrease from getting pressure ulcers. Constant attentiveness in ICU or immobilized patients can prevent pressure sores. Pressure ulcers, they have four stages. The first stages is persistent redness of the skin. The second stage is the formation like bubbles, like blister with fluid in it. And the third stage is damage of the skin, and the fourth stage is when the skin is necrotic. Why is pressure also is important to healthcare? Pressure also is important to healthcare, and it also been always been a constant issue with hospital and long-term facilities, especially when it comes to bedbound patients. It increases the risk of illness and deaths, increases healthcare costs, increases pain, depression, loss of independence for patients, increased infection and sepsis rate. Pressure also is significant to nursing by nurses have to provide vigilant care, like eliminating wrinkles, not having so much layers of sheets on the bed, especially in an A mattress. It's better to just have like a pad so air will be able to get to the body. Continuous reassessment, managing moisture and incontinence, gaining continuous knowledge, communication with patients and other team members. Reduce mechanical loads like frequent repositioning and turning. Ensure adequate nutrition. So if the patient is not eating good enough, you make sure you get them like a supplement and eliminate friction. An overview of the literature review on pressure ulcers are most critical patients, mainly in ICU, are more likely to develop pressure ulcers. Several variables contribute to developing pressure ulcers. Annual competencies are to identify to prevent pressure ulcers, identify development of stage 1 ulcer, adopting measures appropriate for high risk patients, and risk assessment and prevention measures and also ulcers frequency. The methodology of summary is standard steps to help bias reliable process to ensure that objectively and accuracy results are maintained and have received. Use prediction tools such as the breathing scales, and it's also good to do the breathing scale at least twice a shift. So in case the patient have a change, you know when it occur. In case one misses, somebody else will catch it. Mobility complication that is related to autonomic nervous system. Identify individuals in ICU setting who has improvement skills and ask them to get involved in the study. And the reason for that, those nurses who working on the floor will know better what the barriers will be. Like, is it nurse ratio? Is it supplies? What is it that's causing them from being successful to preventing pressure ulcers? Having a reporting plan for leadership constantly, because once they know it's important, but if it's not constantly coming up in meeting, they're not constantly seeing numbers or seeing something happening pertaining to pressure ulcers, it is going to be put in like the back burner. So it's best to like continue to like do more frequent competency and evaluation of the unit to see how is it could be brought up to leadership. Initiate an improvement plan such as PDSA, which means Plan, Do, Study, Act. Understanding current ICU's process for ulcer. Prevention of pressure ulcer. So viscoelastic foam, it reduces pressure on the bony premises. Oily extraction, more like a natural. Specialized bed on a mattress. Repositioning often, mostly every 2 hours or less. Special skin barriers and ointments. You could reposition a patient like with a pillow, with a sponge, with many different things. There are many different devices out there that could help you prevent pressure ulcer. This is a pressure ulcer prevention guide. This is a way that could be positioned, and these are the pressure points that is prone to get pressure ulcers. The data analysis plan, pressure sores, pressure ulcers, ICU, is a key related word that will be looking for data. I'll be focusing on readmitting and length of stay in ICU. Difficult medical database, focus on prevalence of pressure sores in ICU. Intervention procedures, group patients by age, sex, and other variables, like for instance, are they diabetic or they have cardiac issues? What is the complications that's causing them to be grouped together? Data collection procedures, prevention data, identifying risk factors, cause of pressure also for patient in ICU, risk assessment skills for ICU patients, reviewing documentation like skin assessment, how often the patient is being repositioned, how much of the meals are they eating to know if they're having enough nutrients to help with the healing process, and patient nurse communication, because your patient always knows what's best for them and they know how much they could tolerate. Collecting data from multiple database will be responsible for gathering information that will be recorded in documents and while waiting for analysis. Ethical consideration is very important because you always want to make sure you have an informed consent for everyone who's taking part in your research. You're evaluating the data and storage method. You're taking accountability, and you're keeping every information confidential, and obligations to research studies and responsibility for patient rights. Summary: observation of severity of patient condition that helps with development. HANA is the best way to reduce pressure ulcer stage in ICU patients. Evidence will give better understanding of occurrence and prevention. Conduct timely evaluations. So instead of having it once a year, we have it more frequently. Consider limitation of studies. So it's not gonna be broad as much broad, but it's gonna be like minimized. Existing knowledge of the what is causing pressure. Also, what is the epidemiological of pressure ulcer, and to have a better understanding. Explain the importance of new ways to help treatment and prevention, like what could be done different now that was done a couple years ago to make a difference to prevent pressure ulcers. In conclusion, nurses have a major role on developing and prevention pressure ulcer just because they work so closer to the patient than anyone else. And pressure ulcer is continued to be a challenge for decades for nurses and patients just because it could be for patient ratio, lack of supplies, for multiple different reasons. This issue has been underestimated by healthcare officials, by nurses, by everyone. Because the pressure ulcer will start really quick. Within from morning, you laying, if a patient is laying in urine and they haven't been changed whole day, you could have like a stage one coming up like by the end of the night. Prevention also is also a sign of quality of care. As for now, a useful risk assessment is needed for the ICU. Studies needs to be done that will help with the burden of healthcare workers and decreased cost. With a comprehensive plan, many ICU pressure ulcer plan can eliminate. My self-reflection, I reflect on my learning outcome, my learning process, and writing, analyze, evaluating information, have a more powerful action plan, identify what could be done differently and consistent. What would I have done differently with my literature review? One thing that I would have done differently is grouping articles in categories so it would be more organized and managed. And these are my references. Thank you.